Hey there, Dr. James Petrick with Prior Lake Spinal Care. If you're considering chiropractic for treating your vertigo symptoms, that's a pretty wise decision because there's only a few known causes for vertigo, and chiropractic may be of benefit for you, especially if it's in the latter category of these three causes. So there's three things basically that allow you to feel balanced and having equilibrium within our gravitational environment. Of course, the brain, the inner brain's perception as to what neutral and upright is. And a lot of that has to do with our visual input. If I tilt my head this way, I can see that the world is slanted, and now I don't feel as slanted, and therefore I feel more balanced. There's another kind where the calcium crystals of the inner ear can get sloshed around and end up in the wrong position, and then our internal sense of what normal feels like can be off as well. There's a third category, and that's something called proprioception. And this has a lot to do with the classical field sobriety test. You've maybe seen videos of a police officer having a person stand and do this and close their eyes maybe and have their arms out like this and to do different fine motor movements with their hands. And the reality is that we have proprioceptors, or these joint position sense pathways throughout our body. And that is what is responsible for telling your brain where your body parts are in space, independent of your eyes. For example, right now I know that my fingertip is about 6 inches away from my nose. But how well do I perceive that right now because my eyes are closed? That has to do with joint position sense. That's proprioception. So it's how does our body parts relate to each other, and how is our whole body dealing up against gravity? That's the one that classically chiropractic tends to help with. Now, the reason that upper cervical chiropractic is of benefit in a lot of cases for these individuals, whereas perhaps maybe a more traditional or standard form of chiropractic care might not be as helpful, is because of the close attention that we pay to the upper couple of neck vertebrae and their alignment. So you have, as I mentioned, you have proprioceptors throughout your entire body. Most of the proprioceptors, most of those joint receptors that tell your brain where your body is in space and how they relate to each other, are actually located in the top two neck bones here. So you have axis and you have atlas. So when I turn like this, that's pretty much the first 45 degrees of that movement. 90% of that is purely atlas on top of axis, okay? And when we extend and flex down like that, you have patients that spent the weekend painting their ceiling, and they can feel this disequilibrium, like the world is spinning around them or they're spinning around the world, and that is vertigo. And a lot of times that's because their neck was stuck in this position, and as you can see, just based on the shape of the joint right there, its main function is a rocker kind of motion like this, back and forth on that top bone. And just like atlas rotates a lot on axis, the skull flexes and extends mostly in this motion right here, mostly in this amount of motion. That's pretty much purely skull on top of atlas. Okay, so a very, very narrow margin of error here when we're talking about the alignment of the upper neck. Now, you might have seen a chiropractor before, and maybe you did that for vertigo, maybe you did it for neck pain or headaches or shoulder pain or lower back pain or for something else. But if you're still struggling with vertigo, you might give upper cervical chiropractic a try, because not only are we interested in getting the vertebrae to move better, when we go to the nth degree to make sure, if this is a key and it should go into the slot, if it's the correct key, you shouldn't have to try to jam it in there, right? So here, we pride ourselves on knowing the shapes of these joint surfaces, because they can be different from person to person. If this side's up a little bit higher like that, and if it's sloped like this, guess what? A classical I don't want to say cookie cutter or hand me down, but a classical segmental kind of generalized manipulation or adjustment in the person with vertigo, it may not help them in a way that more of an upper cervical based procedure can, like NUCA. That's the practice, that methodology that I've used for the past 20 years for a lot of results. People with vertigo, disequilibrium sorts of problems, even nausea, especially after car accidents, whiplashes, injuries like that. So if you're thinking about chiropractic as an option for vertigo, it's a really good idea. Usually people respond. If they do respond, not everybody responds, but usually it's within a couple of weeks people would start to notice improvement. So feel free to reach out to us and discuss further. We can do a phone consult, or you can come in here and we can do a free consultation. If we want to take the next step, we can talk about x-rays and doing a complete examination and everything.